Today is December 26, 2018. This is going to be a series of Q&As. This is number 1 out of 4, and this Q&A is actually something I got asked a number of different questions, and there was one person who basically asked overall this one question that everything would go into, and I thought I would just kind of put it out there as one series of Q&As. And the Q&A that the question that I was asked is how did things go this annual election period? Now, for those of you who don't know what an annual election period is, that is the term that Medicare uses for that period between October 15th and December 7th of when you can make a change to your Medicare Advantage plan, prescription drug plan, virtually every other Medicare-related type of insurance available in your market, with the exception of a Medicare supplement. Medicare supplements don't follow annual election period rules. Employer coverage may or may not. It depends on the employer's coverage. Ask the employer whether or not it follows or not. However, the majority of my clients, the annual election period, my clients will call it open enrollment, annual enrollment period. I'll pretty much nod my head, say whatever it is, because they're not meant to be experts on it. I am. So Medicare, or at least, I'm not meant to be incompetent on it. So I'll say whatever a client wants in terms of what it's called, but it is called the annual election period. And I thought about it, and I learned four primary things this year from the annual election period, and I wanted to do a series of videos about what I learned to help you kind of understand what is out there. My videos are watched, I've noticed, by both insurance professionals and by clients and people about to go on to Medicare, people that are on Medicare looking to get a little bit of guidance. So these videos, this series tends to kind of lean a little bit more towards the insurance professional, but I'm going to keep it pretty simple to where people that are actually trying to educate themselves about their own Medicare benefits will get a little bit of information as well and hopefully find it useful. Okay, here we go. So the first thing that I learned, probably the most interesting and most important thing, is the messaging that came out in advertising this year is very confusing. People were led to believe that they are missing something that they either already have, or they're missing something that they don't actually need. In a way, this is something that I've touched upon in other videos, and it's actually the advertising and the messaging. A lot of it seems, at least in the areas I serve, to be put out by the insurance companies. Now, that's not to say that anyone did anything wrong. Far from it. I assure you, every bit of messaging, every bit of advertising you got that came from an insurance company and most brokers was probably dead on accurate in terms of what the benefits are. I'm talking about the value of the benefits to my clients, to you if you are my client or a potential client or trying to figure things out. These may not, some of the things that have shown up in the Medicare Advantage plans or Medicare plans this year that we're really focused on are actually not really what you need insurance for. A great deal of my questions that I had to answer this year from my clients had to do with things like, is dental included? Now, before you go, dental is important. Yes, dental is important, but Medicare plans package everything into them. Medicare plans package in the service and the cost that's going to fix you if you have a heart attack. It's going to pay for the service that's going to fix you if you have a heart attack. It's going to package in the cost of a stay in the hospital. It's going to package in the cost if you trip on the ice in some of these winters that we have had in the past and may even have again this year. It's going to package in the cost of physical therapy. It's going to package in at least a limited amount under the right circumstances of long-term care, although it's really not long-term, forget it, not long-term care, short-term care. You're going to get 100 days in a nursing home, maybe, assuming certain criteria are met. It's going to package in all of those things, these big ticket items. And the number of people that have called me to ask me if their insurance is worthless because it doesn't include dental services is incredibly high. I have had to have this kind of discussion that I'm telling you about right now with a great many people this past year, and I've had to tell them remind them exactly what they're buying their insurance for. We want our insurance to do everything, and we want to do it for as low a price as possible, and that's fine. In my own personal life, I do that too. But we do sometimes need a bucket of cold water thrown on our faces and to remind us, hey, it kind of sucks if your insurance doesn't do it, but let's take a look at the other things your insurance is doing. The other thing that's not being addressed when people are looking at that is they're looking at the overall cost of the little things. Now we're going to talk about this. That's actually in video number 4. That's actually one of the things that I go over is that I've noticed the costs are shifting and not necessarily in your favor. They're just shifting, or not necessarily in clients' favor. They're just shifting. But I've had so many people ask, is there dental, or I want to go to my doctor and I don't want to pay anything. Okay, that's fine, but remember, do you not want to pay anything if you go for a visit to see your primary care doctor for just a checkup, or do you not want to pay anything or do you want to pay as little as possible, I should say, if you have a heart attack, stroke, or develop a debilitating disease and you want insurance to pay for it? You're going to get one or the other. In a lot of cases, you're not necessarily going to get both. So it's very important. These are the questions you've asked. I had 0 people actually ask me that first. Not a single person asked me that. Of all the people that called, and there were a lot of calls this year, folks, about what their Medicare benefits are, nobody asked me if they would have their coverage working for them, or how much they would have to pay if they had a heart attack. They were all asking how much they would have to pay if they had to go to a dentist. You can swap out the word dentist, by the way, with gym membership, hearing aids, which are expensive, I grant you, eyeglasses, in some cases vision, but for the most part they were asking about eyeglasses. I don't get it. And I actually had a few people ask me that about acupuncture, which is not something that I actually get too many people in my area asking about, so that was new. Excuse me, I figured I'd be doing a lot of talking, so I prepared a cup of coffee. So the messaging that has been getting out there has been to focus on and to emphasize those little extra benefits out there. Now, there is a reason. The insurance companies were not doing anything wrong, and they weren't doing anything deceptive. All Medicare Advantage plans have to cover at least the same amount of benefits as Medicare Part A and Medicare Part B, which means they're all covering the same basic benefits. So what they're doing is every company is focusing on the little bit of extras that they're offering. Those little bit of extras are the only competitive advantage an insurance company has, and that's fine. But I don't work for the insurance companies. I work for my clients, and that's kind of why I'm making this video. When a person hires me, I'm working for them. I can move you to an insurance company, and that's how I do make money. excuse me, you don't pay me, the insurance companies pay me. But the way the insurance company pays me is through, if it's Medicare Advantage, a fee, if it's through a Medicare supplement, a commission, and whichever company you go to is how I get paid. So my thing is to get you into the best company I can so you will be happy with that company. But I am working for you. The insurance companies really aren't paying me anything more to direct you to one company over another. So what I'm doing when a person asks me these questions is I'm breaking down these extra benefits. And in some cases, these benefits are meaning the world to some people. And I've just got to remind them, look, this is great, but we've got to do some other things. Okay, if you have a heart attack, it's going to be covered, but this is what your cost is going to be if it's going to be covered. More importantly, if we're talking about a Medicare Advantage plan, are the providers and hospitals you want to see a part of that network? That's my job too, to double check that as best I can based on who you have. So I don't want, I have refused, I don't believe I actually refused anybody this year, but in past years I have actually refused to put people in plans that did not want me to double check to make sure a doctor or a hospital is part of that network, because when you go into these plans you're locking yourself into a network. Now remember, this has nothing to do with a Medicare supplement. Medicare supplement is totally different. Quite frankly, they weren't really advertised that well during the annual election period. They never are. They are advertised by a few companies, but not really that much. It's the Medicare Advantage plans, the prescription drug plans that are advertised. So that's what we look at. On that same note, when the messaging is confusing, it's also confusing on the drug side. So my Medicare supplement clients who have standalone prescription drug plans, the calls I got from them were, how do they get free generics? Now, if a person takes 2 or 3 very inexpensive generics, that's actually a fairly easy, that can actually be looked up fairly easily, and there may have actually been a few of those. But when I've got clients who are calling, they have multi-$100 brand name drugs, and they call about getting free generics because they saw an advertisement for it on TV or on Pandora or on the radio, whatever, we have to go back and take a look and see, okay, if I can get your cholesterol medication covered at nothing and your blood pressure medication covered at nothing, but they won't even cover at all the medication for your heart, I can't put you in that plan for a number of reasons. You don't want to be in it. Really, it's for your own good. I've got to make sure that your drugs are covered. Every drug you have to take has to be covered. And sometimes, if you are taking an expensive prescription, that means that you are going into a plan that is going to cover your generic drugs a little bit worse than you might have your neighbor's generic drugs covered, because I need to get that very expensive brand drug covered for you at as low a cost as possible. So if I'm making you pay $6 for 2 prescriptions rather than for 2 generic prescriptions, but I'm making you pay $150 for a brand rather than $500 for a brand, you would rather pay those $6 for the generic drugs, right? Yeah, you would. So when we look at these prescriptions and these prescription plans, it's not about necessarily getting you the cheap drugs even cheaper. It's about making the expensive drugs affordable. Okay, so that was the first thing that I learned from this annual election period, is that the messaging is really getting confusing. The end of all of our educational videos on our website, www.mymedicareinsider.com. If you haven't gone there, please go there. We spent a lot of time putting it up. Ashamed if nobody looks at it. We end every one of those videos with the message. If you have any questions, give us a call. Talk to a licensed insurance agent or a knowledgeable insurance advisor. basically make sure that the message that they want you to hear is complementary and is in the best interests of what you need to have for your insurance. It's very easy to buy this stuff online. You don't need us to buy insurance. I've said that before in a number of Q&As. I am useless for the purchase of insurance. It's how I make my money, but I'm useless for it. What you need me for is to walk you up to that last step. Make sure that the decisions that you've made are correct. You are never going to know the fine print as well as I will, unless you're actually in the health insurance industry and you understand insurance fine print. You are never going to understand some of that stuff the way we do. Some of us have been doing this for decades. I'm one of them. Health insurance is complicated. The messaging they try to make simple. I try to make this simple too. I babble a little bit, as you're hearing right now, because it's important that you actually know, the reason we babble and kind of go on a little bit right now is because we want you to know that it's not quite A plus B equals C. There's a little bit of nuance in some of this stuff, but it's important you always, always, always talk to someone, me, somebody else who knows what they're talking about how Medicare works with your lifestyle. Don't just take the messaging and say, okay, I'm all good. Make sure that what you get is going to work the way you want it to. Okay, that's video number 1. Go to the next video in this series for question number 2, for the second thing that I learned this annual election period. Thank you for watching.